The topic of my persuasive speech is the rising cost of prescription medication. What would you do if you had to choose between your life-saving daily medications or to eat? In 2020, my father came out of the hospital with several morbidities that were pre-existing. He was already a type 1 diabetic, but had been diagnosed as a type 2 diabetic. That increased his medications. He had to take a type 1 diabetic medication called Januvia, and he now had to do a dial-up injectable pen, a Bascalar pen, both which were very costly and outside of the cost of his Medicare Part D plan. For the Januvia, it was $128 a month, and for the Bascalar, it was $127 a month, neither of which he could afford. He had tried to qualify for Medicaid and food stamps. They were giving him $16 a month in food stamps, and he wasn't able to receive Medicaid. So it became one of our missions to make sure that he had the drugs and the pharmaceuticals that he needed to sustain his daily living for as long as possible. So that leads me back to this speech. In December of 2019, a Gallup poll led by Dr. Robin Yabaroff, the lead author of the American Cancer Society study, found that 25% of American adults delay health care because of their trouble paying medical bills. More than 8% of those are 65 or older, and they don't take their medications as prescribed because they just can't afford them. Even though Medicare was established in 1965, it only provides basic health care protection, and it's not inclusive or free. I believe my father was paying somewhere around $30 a month for his Medicaid Part D, which didn't cover all of his medications by any means. Like I said, he had to pay additional out-of-pocket costs against his Social Security, which was only $1,550 a month. So he was on a very strapped budget to pay all of his necessities himself. The Social Security Healthcare Financing Review for winter of 1996 estimated that 19% or 5.9 million poor or nearly poor elderly were at higher risk of death or near-death emergency room visits because of the lack of health care and because of the high cost of prescription medications. I believe that health care should be inclusive for all of our older people, 65 and older, because of the simple fact that they've sustained themselves. They've worked to better this country. They've had children. They've been around. There are elders. They deserve the respect and care to the highest quality that we can afford to them. During the Obama administration, the Affordable Care Act was put into place to assist some of these as an additional supplement. But unfortunately, in 2020, President Trump repealed that act. But thankfully, recently, President Biden was able to reinstate the Affordable Care Act. However, it still doesn't cover all of the necessary medical items and prescriptions. So how can we help this struggle? Can we do to control these drug costs? Well, number one, we need to lobby to regulate monopolies. For example, Novo Nordisk, Sanofi Adventist, and Eli Lilly are the three monopoly companies that control insulin. We also need to work for patent reform. We also need to ask our Senate, our Congress, and all of our elected officials to help us work on getting FDA to approve generics and biosimilars that will also be a competitive pricing against the monopolies. And we also need to cap the price increases on all prescription drugs. So those are the larger ways that we can help out, by contacting our elected officials, by writing to these companies and asking them to lower the cost, to make them more affordable. But the simple everyday things that we can help to do are, if you have a person 65 or older in your life, help them and make sure that they're getting to the doctor. Help them and make sure that they're getting their prescriptions and asking for the lower cost drugs, because more than 21% of those poor and near poor people were asking for lower cost drugs just so that they would be able to live and sustain life longer. I would also ask you to, on behalf of your people that are 65 and older, is to write and ask for, it's called prescription coverage or vouchers from these companies to help them afford. In my dad's case, luckily, his doctor was able to help him and give him samples to sustain him for periods of time while we built up money to buy the prescription drugs. For Januvia, I forget the pharmaceutical company, but we were able to write them, and they gave him 3 months prescription for free, which was nearly $400 worth of medicine. That was able to help him so that he didn't have to come out of pocket and be strapped and possibly not eating right, or not eating for nutrition, but only eating to control his diabetes. So in conclusion, healthcare is a major benefit to all of us. And as a younger generation, we should be responsible enough to make our elected officials take care of the older generations, because they've done what they can for us, and it's our time to take care of them. Thank you.